I'm a professor, Dr. Rakesh Yadav. I'm a professor of cardiology at All India Institute of Medical Sciences, New Delhi. And also I'm a secretary of Indian Heart Rhythm Society. I think it's a wonderful conference. I am seeing the halls are practically full, and the academic content is excellent. And this academic content, I have seen the academic content, it covers practically all the part of practical cardiology. So this conference is not only for a cardiologist, for a physician also who are seeing the patient of cardiology. So a wonderful experience. I have just said that the conference is a wonderful conference. Seeing the halls are jam-packed. The content is very good, the academic content is very good. Practically all part of cardiology is covered, including intervention cardiology, electrophysiology, basics of ECG. As I said yesterday, there was a basic course which is a very important tool in diagnosing cardiac diseases. And the most important thing that the lectures which are being presented by various faculties are so that it is being understood by every person, including physicians also. And I think a lot of physicians are also taking part in this conference. Because now what we are seeing in cardiology, this cardiology is not a simple branch. Now the cardiology is being split into so many branches. The diagnostic part is, the echo is entirely different, the pediatrics is entirely different, the electrophysiology is entirely different, intervention cardiology is entirely different, and in some part epidemiology is entirely different. So the cardiology is expanding like anything, so gaining knowledge in every part of cardiology, practically it becomes very difficult. So what is a message to the young physician, I think, who are aspiring to have to do a course in cardiology? The most important thing, that choose your line in the first time. Don't think that you can do everything. You can do coronary intervention also, pediatrics intervention also, structural heart disease also, electrophysiology also, because now the cardiology has expanded a lot. So please choose your line in the first when you are aspiring to become cardiologist. But most important thing, that in our developing countries or underdeveloped countries, it is most important thing that you have to see all the patients. So you cannot ignore that if you are electrophysiologist, you are not going to see the MI patient, or you are not going to see the hypertension patient. So in what I always suggest in countries like us, that you should be jack of all, but you should be master of one discipline of cardiology. The only suggestion is that what I have seen, that the program is, they have to choose certain things. If it is a live, Bangladesh live, I think you should avoid going for basic sciences, basic cardiology, lipid cardiology, or hypertension. So the basic lectures should be avoided when you are having a Bangladesh live, means you are going to be more in favor of intervention cardiology. And intervention cardiology itself has expanded so much that if you want to do 2 halls for 2 days, I think you can only cover coronary interventions. So my suggestion, what I am seeing, that people want to learn more intervention cardiology part, live cases, learn from the masters, rather than a faculty presenting what are the current guidelines of management of hypertension. Because they can go on net and they can read the guidelines and they can very well practice the guideline. But the practical aspects is usually not learned by the YouTube knowledge. So you require some master to express their guidelines, express their way of doing intervention, express how to bifurcate yourself from the guideline to the clinical practice, because there are a lot of things which is happening in developed and undeveloped country, and you can actually not follow the exact guideline which is being given by the Western country.